Hello and welcome back, guys. Let's talk about more in infections and the common scenarios and questions. You will find a question about meningitis and meningoencephalitis. Yes, the passage is clear. The patient has a fever, neck rigidity, maybe altered mental status. There is a CSF analysis. That's where is your key. You need to understand which one is viral and which one is bacterial. Very high pressure, high protein, very low glucose, a gram stain culture positive, then that's a bacterial infection, and you have to hit hard with at least two antibiotics. And if it's a pseudomonas, you need to add another anti-pseudomonal infection. And if it's streptococcal pneumonia, you need to add dexamethasone at least for 4 days. That's where is the question. CSF analysis, then the antibiotic treatment. If it's meningoencephalitis, the patient will be more encephalopathic, more altered mental status, may go for coma, may have a behavioral changes. MRI may shows temporal loop changes, and EEG may shows temporal loop lateralization. That's more kind of encephalitis. Autoimmune encephalitis tend to be more subacute. Patient not that sick, but the family usually will tell you he's not his usual. Start to have some kind of delirium, dementia, agitation, psychosis, some limbic system changes. Then you're gonna think about autoimmune. If you do an MRI, you may see some limbic area changes, maybe focal to one of the brain areas, maybe nothing. CSF analysis will be not clear as a bacterial, not truly viral. You'll see maybe pressure elevated a little bit, protein is a little bit high. And if you think about it, you need to do CSF analysis for anti-NMDA. You come back positive, then you have the diagnosis, sometimes associated with paraneoplastic syndromes, teratomas, and the treatment you have to remove that teratoma and use strong antisuppressive medications. Those are your clue. The other infections are skin infections. They will give you the scenario, the clinical picture is there, but you'll have also a photo with an ulcer. In general, for an ulcer that is not responding for regular treatment or outpatient treatment or local topical mupirocin, topical antibiotics, then you start thinking about, okay, what's happening here? Let's go and see if this patient having those non-healed chronic ulcers. If it's painful, if the patient has a neutropenia, then you start thinking about eczema, whereas the bug is Pseudomonas or staph. Usually they will ask about the bug or the diagnosis here. If it's painful in the lower extremities, may be associated with symptoms of GI symptoms, inflammatory bowel disease, or arthritis, then you think about more erythema nodosa. If the patient is painful ulcer, chronic, non-healing, they will mention that maybe the patient is not diabetic or there is no peripheral vascular disease. Then you start thinking about this is more bioderma gangrenosum associated with other kind of vasculitis or other autoimmune disease or maybe cocaine use. So then you'll think about bioderma gangrenosum. Of course, your differential diagnosis also may expand in reality for more other type of vasculitis and autoimmune disease. You need to go back, check your Google images or MKSAP images and see and really get some image memory for that photo of eczema, gangrenosa, for superficial cellulitis, thrombophlebitis. Those are your differential diagnoses. The other question will be about Lyme disease. In a Lyme disease, they're not going to ask you about the diagnosis. This is step one, step two. But in internal medicine board and the IT exam, they will ask more about and focus more about the treatment. Treatment for Lyme or even for diagnosis. If it's an early phase and there is the target lesion there, you don't have to do serology. You just start with the treatment. The treatment is doxycycline for at least 14 days to 21 days. If the patient has severe infection, which is CNS or carditis, then this will need an IV treatment with penicillin, maybe ceftriaxone for 21 days. If the patient has arthritis, joint, or facial palsy, then you will treat with doxycycline for at least 14 days. Okay. Another one of those you're gonna see is babesiosis, which is again you will see a clinical picture of kind of malaria, but not in an endemic area, fever, spiking fever, hemolysis, bleeding, this and that. But they will give you the blood film, so you just check the blood film, look for the erythrocyte that is in the middle of the slide there, Maltese cross. That's the diagnosis. Babesiosis. Usually they ask only for the diagnosis.